Welcome, everyone, to the HealthLinks podcast presented by the HealthLinks family of services. I'm your host, DJ Thatcher. Our mission here is to engage in conversations about the health and medical landscape of South Carolina so that we're all better informed. In this episode, we're really focused on our physical well-being, and not just when we have a problem, but also in being proactive. We have with us today Jared Lethco, who is a doctor of physical therapy from Grace Physical Therapy. And Jared, welcome to the HealthLinks podcast.
Yeah, thanks for having me.
So, Jared, first of all, many people are getting to be aware of this now, but many health providers now have doctor in front of their name, and they're not a medical doctor. But hey, tell us about the educational requirements now for becoming a physical therapist.
Yeah, that's a very important factor. You know, the field of physical therapy has grown so much over the last several years. The licensure is now a doctor. The doctor training allows us to be much more thorough in the differential diagnosis. The state of South Carolina has opened up physical therapy for direct access for patients, which means we get patients straight off the street coming to us, and we have to be knowledgeable enough to determine whether that patient is appropriate to be with us in physical therapy, or they need to go somewhere else if they have some other serious pathology going on because they haven't first seen a medical doctor per se. So that's why the training has gone from the master's level to the doctor level, so that we are better equipped to serve people that are coming directly to us under the direct access provision in South Carolina versus coming from their physician originally.
Okay, well, that's interesting. You know, I guess many years ago, people considered a physical therapist someone you go to when you are rehabbing from an injury. Maybe it's, you know, your grandparents go there for help and they're ambulating. You were referred by a doctor. And like I said, today, it is direct access, though. So people can contact you directly for not only health restoration, but also preventative medicine, right?
Yeah, absolutely. I have many patients who might be, you know, play tennis on the weekends or runners or a whole myriad of things that they may have something that they've hurt yesterday, and they've seen me in the past, and they call me up and say, "Hey, Jared, I sprained my ankle," or "Jared, I hurt my back. Can I come in and take a look at it?" It's much easier to fix those kind of injuries and illnesses in that short amount of time that since they've had it. What we saw in the past is that the patient would call their doctor, and their doctor would send them a referral, and it would take 3 or 4 weeks for them to get to me. And by the 3 or 4 week point, they had all these other things that had already happened because of their injury state. We're now able to avoid a lot of that secondary issue just by seeing them as early as possible in their injury state.
That's terrific. So tell us a bit about Grace Physical Therapy. I know it's a full service physical therapy practice based in Summerville, South Carolina. Of course, what we're talking about here today is relevant no matter where we are in the state. But hey, tell us more about your practice.
Yeah, absolutely. We are a private practice here in Summerville, South Carolina. We started in 2008. I'm the second owner. I came in 2014, and I've been here since then as owner. And we really strive to be that small town private practice therapy center. We feel like sometimes patients get lost in the big box centers, and we strive and make it our priority to make sure that we stay small enough that we can give our focus fully to the patients that's in front of us. The patient is always our number one priority, and we want to get people back to their highest level of function as quickly as possible. And that's always our goal.
And that small town appeal, I mean, you live that. You are from Summerville, went locally to college to Charleston Southern and then to MUSC for your physical therapy education. So what got you interested in physical therapy? What's your story?
Yeah, absolutely. That's exactly right. I grew up in the area. I played sports. I played football and basketball. I played a little basketball at Charleston Southern. And wow. I was always in the training room and in the field. And then I ended up injuring myself and going to physical therapy. I think that's the story of a lot of physical therapists. We tend to find our way into the clinic somehow, and we kind of just get stuck, and we love the atmosphere, and we love being able to, you know, be somewhere where we can directly help people, and I can have someone come to me hurting and leave feeling better. And that's really gratifying for a profession to be able to do that.
That's good. Now, what all do you provide as far as the specific services at Grace Physical Therapy, and how many physical therapists do you have, that sort of thing? Mm-hmm.
So we have myself plus 4 other physical therapists. Mm-hmm. we provide a myriad of outpatient services. So anywhere from your post-op, as you mentioned earlier, to people coming in for, their backs or their necks or ankle or knee, anything orthopedic that you can think of, we tackle here at Grace Physical Therapy. We also see patients from early adolescence all the way up to, I think my oldest patient right now is in their 90s. So we see a very wide variety of different injuries and ailments.
Are you still seeing a majority of people who are coming to you after an incident or an injury? Is that still the bulk of what you're seeing?
We do. And that's the majority, because I think that's the thought process behind physical therapy, as you mentioned earlier. For so many years, it was, well, my doctor sent me here because I was injured. We strive in our patients to educate them as far as thoroughly as possible on what has caused their injury to happen and what to look out for in the future. And we've started promoting a kind of a yearly checkup. Patients go to their physician once a year for a physical. It's worthwhile to go see your physical therapist. If you have, my shoulder's just not quite right, or I'm playing a lot of golf and I feel a little stiff. A lot of times it's much easier to fix a problem before it starts. Whether it be your body or your car or your house, it makes sense for people when we talk about those worlds. It just doesn't come to our brains necessarily that, oh, my body is breaking down a little bit. Take a look at it. Take a look at it before it starts to hurt.
That's a great point. I have a big bill here for a home repair. So yeah, it's true.
Yeah.
It's so
much less expensive to fix it before it gets bad.
When you see some of these clients, some of the patients that you have who are there because of a medical issue, if you could wind the clock back, what would you have done differently with them, like prior to their acute injury or something like that? What type of advice would you give people, for example?
Much easier to do preventative medicine, and that's in every medical field. So whether you go to your general practitioner, your primary care doctor, or your orthopedist, or your physical therapist, the medical field right now is promoting prevention. It's not only easier, it's less expensive for the patient, it's less expensive for the facility to take care of your body earlier rather than later. And so what I tell people is stiffness almost always precedes pain. I give patients that leave me some easy things to do every day to make sure their body is still moving correctly. Joints have a very specific way they need to move, and they need to be able to bend and turn and rotate. And if they're not doing that, something's wrong. It might not hurt yet, but something's not working appropriately. And you need to get that looked at, because it's much easier to take care of at that point than it is when it actually does start to hurt.
Sure. I know from experience, many people will see a physical therapist because of an injury, and they love the treatment and they think, man, I wish I had known about this prior, or I'd gotten some education. And I know that oftentimes, even after an injury is healed, people want to continue consulting with you. You've got a great website I'm looking at right here. And one of the things you mentioned in there is this med stretch, the play, stretch, repeat program. What's that all about, Jared?
So we found that there was a factor lacking in our treatment. And that was what you were talking about as the follow-up care. So we have patients all the time who, they may have been recovered from their surgery or from their injury to the point that they don't need 2 times a week seeing me for physical therapy, but they still want a little bit of help. And so we've created this program that's called our Med Stretch program that allows patients at a self-pay rate that's very reasonable to come in and just get some supervised and manual treatment, some supervised stretching care, some supervised information and knowledge that will help them not only compete better or play better or live better, but also reduce their risk of re-injury and really just improve their quality of whatever they're doing in their lives.
Do you find that many people need a reminder or a refresher of proper mechanics and so forth? That,
even when you're giving information and pictures and writing and, you go home and you do it and you just forget. Or your technique gets poor, or you kind of just get slack on the way you're doing things. And a refresher for anything is never a bad thing.
Sure.
For our license, we have to do so many hours a year to maintain our license. It's a refresher for our knowledge base. Same thing with your physicians. So same thing with your dentist. even as professionals, we need refreshers. So the same thing goes for the patient. They need a refresher sometimes.
Sure. And speaking of your medical education or medical continuing education, what are some of the things that are on the forefront or maybe new in the entire field of physical therapy that we can watch for?
We really focus on, and not only us, but as a whole, the medical field. A large portion of the medical expenditure in this country has to do with low back and neck pain. Probably 80% of our volume has to do with some sort of spinal dysfunction or spinal pain. We go through a ton of education about how to treat that and how to differentially diagnose that. And so that's really important. If you're looking for a physical therapist, look at their website, see how they're trained, see what their specialty may be, and call them and ask them and talk to them. And a good physical therapist should be willing to, have a conversation with you about, hey, why am I appropriate to be in front of you and be your patient?
Sure.
We should do that with all of our healthcare providers. We should hold us and hold me to a higher standard because the patient's really the one in charge, and that's why we're there.
So we have a listenership, of course, throughout South Carolina. We're hoping people will reach out to you at Grace Physical Therapy. But of course, you're in the Low Country. You might have someone in the Midlands or the Upstate. What are maybe some of the specific things people should look for in finding a physical therapist or at least a physical therapy practice? Anything in as far as credentials or anything else that you would look for?
Sure. One of the credentials that I have is I'm certified in mechanical diagnosis and therapy. It's 128-hour coursework plus a national exam plus a lab practical. So it is a very thorough certification that is becoming much more popular now, and it's the most effective way that I have found in my 10 years of doing continuing education to prepare a therapist to be thorough in the way that they're examining patients. So that's one thing you can look for. The other thing that I always advise patients to look for is, look for how much volume the therapist is seeing. I think that a lot of large practices are going to the model of seeing 3, 4, 5 patients in an hour. And, it's hard to give the highest quality care in those kind of settings. And they can give quality care, and some of them are really good at it, but a lot of them lack in the individualized patient care and the individualized manual care that I think is appropriate and it should be the standard.
Terrific. Yeah. And I imagine people can consult with you, and I'm not sure if that's covered by insurance or how that works, just to reach out, get an initial consult and see what you can provide.
Yeah, absolutely. Almost every insurance these days, it will cover at least an initial evaluation for physical therapy. Most insurances don't even require a referral. There are a few Medicare and TRICARE that may need a referral. But as long as you have insurance, you can call, get on the schedule, and have a conversation. We can go through and look at what's bothering you. And, if you're not appropriate for physical therapy, I'm the first one to tell you so, and I will send you to the appropriate place. And I think that's an important factor as well. It's like, if you don't need to be in front of me, I need to help you navigate the difficultness of the healthcare system right now. And that's one thing that we strive to do as well.
It's great to have a friend, or someone who can point you in the right direction. There are those classic stories of people who will see maybe a chiropractor or a physical therapist because they have some neck pain, and you do an evaluation, you realize the person has a broken neck, maybe from an injury. Right. What are some other things that you see that you would refer out to other medical professionals?
Other pathologies that aren't necessarily musculoskeletal, whether it be a heart pathology. I've caught multiple patients who their cancer had returned. And that's one of the things that the doctoral degree helps us through in diagnosing those red flag areas that make you inappropriate for physical therapy. So whether it be some kind of pathology or a thyroid problem or something else that needs medication or an image or things of that nature, that's why we're there. And and we've been trained to do that. And I don't think a lot of people realize that. Even the physicians, they don't quite realize the level of training that we go through to be able to determine if someone's appropriate to be sitting in front of us.
Yeah. How long is the track? How long is a track these days from the time you enter your physical therapy training until you're done, maybe compared to 15 or 20 years ago?
Yeah, so we have a 9-semester program. So then we have 9 semesters that we cram into 3 years. And so 20 years ago or so, physical therapy was a bachelor's degree. So there are still practicing physical therapists who are grandfathered in who have a bachelor's degree. And then it went to a master's that was 2 years, 4 semesters.
Right.
And now it's 9 semesters.
Wow.
So compare that to 8 semesters as med school.
Yeah.
So the schooling itself is just as long. We're not required to do a residency. And I think therein lies a little bit of the difference. We're able to do a residency. So for example, I have a therapist on my staff who has had an orthopedic residency. So she did a full additional year following PT school in residency in Columbia. And so that's an option for us, but it's not required. And I think there's a difference in the timelines between PT school and, say, med school.
Yeah. One thing that the HealthLinks podcast has done is make people aware of the variety of health professions that are out there. We have a lot of people who are listening who just want to better their health, but others who are listening who maybe are contemplating a career in the medical field. And they think, doctor, nurse, maybe physical therapist, et cetera, but they don't really know the intricacies or all of the subspecialties. So it's interesting to learn about that. So
absolutely. And for those people, I would encourage them to reach out to their local PT. Hey, can I come and follow you for a day? I have students that come all the time from our local colleges here and, observe for a day, or just to try to determine if, hey, is this a path that I may want to.
Well, Jared, this is really fascinating. Not only the types of services that you offer, but just getting an update as to what really is happening in the whole world of physical therapy these days and the educational requirements. And love the idea of people who are interested maybe reaching out and getting information or shadowing as well. So you've provided us with a lot. For people interested in reaching out to you, what is the best way?
Absolutely. You're welcome to go to our website and contact us through our website. There's a link there that you can email us. We get it right here in the office. Otherwise, you're welcome to call. Our phone number here is 843-871-3522. And reach out. If you call and talk to the ladies up front, they can get you in touch with one of us as a therapist. Maybe get our email address, email us directly. We're always happy to help with any kind of questions of that nature.
Dr. Jared Lethco from Grace Physical Therapy, thank you so much for joining us here on the HealthLinks podcast.
Thank you, DJ.
Thank you for joining us. Remember, our podcasts are also video-based, and so you can log in and not only hear our guests, but of course, see some of the pictures and video that go along with the subject as well. And as always, for any questions about our guest or for any comments or maybe suggestions for future podcasts, reach out to us at listen@healthlinkspodcast.com. I'm DJ Thatcher. Thank you for joining.